Your primary care doctor gets 15 minutes with you per visit. They check your meds, take your blood pressure, ask about your diet, and they never not once ask you what position you sleep in. I'm Dr. Malik Jackson, neurologist and sleep medicine specialist at Northwestern Memorial in Chicago, 28 years, over 3,000 patients. Before we go any further, left side, right side, or back, drop it in the comments right now, because in the next few minutes, you might want to change your answer. Here's the thing, nobody connects. Think about a phone charger bent at a sharp angle. The phone still charges. Nothing looks wrong. But that cable is degrading a little more every single night. Until one morning it just stops working. Your heart and brain during bad sleep work the exact same way. Slow damage, no warning. Until there is one. I've sat across from too many people who did everything right. Good diet, regular checkups, no family history, and still ended up in my office after a 3 a.m. event they never saw coming. Almost every single one of them had the same look when I explained what was happening during those 8 hours they thought were protecting them. That look that says, "Nobody told me." So today, here's what we're covering. 5 sleep habits that quietly strain your heart and brain every single night, starting with one almost every person over 60 is doing right now. Then the 2 positions that actually help, including one backed by research on your brain's own overnight cleaning system. And I'll tell you about a 5-8-year-old marathon runner who had a stroke after what his wife described as the best sleep he'd had in months. That case changed the way I sleep, and it might change yours too. One quick note, everything here is for education. Please keep your own doctor in the loop, especially if you have existing heart or blood pressure conditions. Here's a number I want you to hold on to. In the US, nearly 800,000 strokes happen every year, and research consistently shows the highest spike is between midnight and 6 a.m., while people are asleep in positions they've never once questioned. That's what we're here to talk about today. Now, let me tell you about Raymond, 67, retired accountant out of Phoenix, and the reason he woke up every single morning for 2 straight years with a headache bad enough to ruin his whole day. Raymond came to me on a Thursday afternoon in October. He wasn't there for anything dramatic. No chest pain, no numbness, no midnight ER visit. He was there because for 2 years, 730 mornings in a row, he woke up with a headache bad enough to ruin breakfast. His previous doctor had run all the standard tests: blood pressure, controlled, cholesterol, fine, MRI, clean. The diagnosis he walked away with? Tension headaches, stress. Getting older, Raymond told me, "I figured it was just part of the deal at my age." It wasn't. Raymond slept flat on his back every night. 3 pillows stacked. He'd done it for years because he thought it helped his lower back. Here's what that was actually doing to him. When you lie completely horizontal, gravity stops working in your favor. Blood travels up to your brain, but it doesn't drain back down efficiently. It pools. Over 7 or 8 hours, that pooling creates pressure inside your skull that has nowhere to go. Think of a garden hose lying flat on concrete. Water gets in, but without any downward angle, it just sits there. Add more pressure from the source, and the hose starts straining at the connections. That's what was happening inside Raymond's head every single night for 2 years. Now add 3 stacked pillows. When your head gets pushed too far forward, the vertebral arteries running alongside your cervical spine get compressed. These supply your brainstem, your cerebellum, the parts of your brain that handle balance, coordination, and basic consciousness. You won't feel that compression in the moment, but reduce blood flow through those vessels for 8 hours a night, every single night for 2 solid years. You wake up with headaches, a stiff neck, a dull ache at the base of your skull, and you think, "I'm just getting older." Raymond had been medicating symptoms that had a structural cause all along. A 2019 study in the Journal of Clinical Sleep Medicine found that even a 1.5-degree elevation of the upper body significantly reduced intracranial pressure, especially in adults over 60, 15 degrees. That's barely the angle of a hardcover book propped open on a table. I told Raymond to ditch 2 of his 3 pillows and switch to a single contoured memory foam pillow, and to elevate his upper body slightly with a wedge pillow. Within 10 days, the morning headache stopped completely. At his follow-up, he said, "I've been waking up like a normal person again." That's the thing about sleep problems. They're almost never random. There's always a mechanism, and once you find it, the fix is usually simpler than you'd expect. Raymond's results aren't guaranteed for everyone. Bodies are different. Always loop in your own doctor before making changes, especially if you have existing conditions. How many pillows are you sleeping on right now? Drop a number in the comments, 1, 2, 3, 4 or more. I want to see what we're working with. What I'm about to show you next is something most people never connect to sleep at all. It has nothing to do with your head position. It has everything to do with which direction your heart is pointing. Real quick, remember what I said at the beginning about people doing everything right and still ending up in my office? This next part is exactly why that happens. Sandra was 71, retired school teacher from Nashville. She'd managed high blood pressure for 6 years, medications stable, numbers in a reasonable range, no major incidents. She came to me not with a crisis, but with a pattern. 3 or 4 nights a week, she'd wake up between midnight and 2 a.m. with her heart beating off rhythm. Not racing, just irregular, like someone tapping fingers unevenly on a table. Her cardiologist had adjusted her medications twice. It kept happening. I asked her one question that her cardiologist never had. "Which side do you sleep on?" She looked at me like I'd asked what color socks she was wearing. "My right side," she said. "Always have. It's just more comfortable." Here's the anatomy that matters. Your heart sits slightly left of center in your chest. When you lie on your right side, your body weight shifts in a specific way. It puts mild compression on the inferior vena cava, one of the largest veins in your body, responsible for returning blood from your entire lower body back to your heart. Think of it as the main return lane on a 6-lane interstate. Narrow that lane even by 1 and everything backs up. Your heart has to work harder to pull blood back in. For a healthy 3-5-year-old, that's a minor inconvenience. The body compensates without blinking. For a 7-1-year-old with borderline heart function and blood pressure already being managed, that's 7 hours of extra cardiac workload every single night. The European Journal of Heart Failure showed that patients with heart failure almost universally avoid sleeping on their right side, not because doctors told them to, but because their bodies told them. It felt wrong, uncomfortable in a way they couldn't explain. Sandra's body had been sending that same signal for years. She just didn't have a framework to understand it. I had her switch to her left side, a full-length body pillow to hug in front, a small pillow between her knees for joint support. 3 weeks later, the nighttime episodes were down by more than half. "I feel like my heart finally gets a break," she told me. That's not just a nice thing to say. That's physiology. Now here's the part I want you to really pay attention to, because this next piece is something I didn't learn in medical school. I learned it from a colleague at 11 p.m. on a Tuesday. About 10 years ago, researchers identified something called the glymphatic system. Here's how I explain it to patients. Your brain runs a cleaning crew. Every night, while you're asleep, cerebrospinal fluid flushes through tiny channels in your brain tissue, washing out metabolic waste, clearing dead proteins, including amyloid beta and tau protein, the exact compounds that accumulate in Alzheimer's disease. This cleaning crew works exclusively on the night shift. A landmark study in the Journal of Neuroscience confirmed that glymphatic activity is dramatically more efficient during sleep and that left-side sleeping creates optimal conditions for that clearance. Think of it this way. Your brain's cleaning system is like a municipal water flushing network. Left-side sleeping opens the main valve all the way full pressure, full flow. Other positions, you're working with partial pressure. The system still runs, but not at capacity. Over one night, the difference is small. Over 30 years? Here's the number that stopped me cold. A 2021 analysis in the Annals of Neurology found measurably higher amyloid burden in long-term back sleepers compared to side sleepers. Independent of other Alzheimer's risk factors, this is a slow accumulation that begins silently, decades before the first symptom appears. The position you sleep in tonight has a biological timeline that extends 20 years into your future. Let that land for a moment. And here's a bonus Sandra didn't expect. Left side sleeping also eliminated her chronic nighttime acid reflux within 2 weeks. 2 problems, 1 adjustment. Honest note, Left side sleeping isn't for everyone. If you have severe obstructive sleep apnea, talk to your sleep specialist before making this change. What if the most powerful thing you could do for your long-term brain health costs exactly nothing, requires no prescription, and just means lying down on the left side of your body? We've talked about your head. We've talked about your heart. Now I need to tell you about something that happens before you even touch the pillow. Frank was 63, corporate attorney in Chicago, the kind of person who scheduled his workouts like depositions non-negotiable, no exceptions. He ate dinner at 8 p.m. because that's when he got home. 2 glasses of red wine to unwind. In bed by 10. Asleep by 10. 15. 7 hours, consistent every night. By every metric he could measure, he was doing everything right. But 3 or 4 times a week, Frank jolted awake between 2 and 3 a.m., heart pounding, sweating slightly, a feeling he described as, like my body forgot how to be calm for a second. He assumed it was work stress bleeding into sleep. It wasn't work stress. When you eat a large meal, your digestive system demands blood. Your body reroutes significant circulation to the GI tract, completely normal. But it means your brain and heart temporarily operate on reduced supply. In a 6'3" whose vessels have lost some elasticity, that redistribution creates real drops in cerebral perfusion during the 2 to 3 hours when digestion is most active. Now add the wine. Alcohol is a vasodilator. It drops your blood pressure. Your body tries to correct heart rate climbs, then pressure drops again, then corrects again. For 2 hours after moderate alcohol consumption, your cardiovascular system is essentially chasing its own tail, spiking, correcting, spiking, correcting. Here's the number that made Frank go quiet. A study in the American Journal of Hypertension tracked adults who had 2 to 3 drinks within 3 hours of bedtime. The finding, the normal nocturnal blood pressure dipped the natural drop that should occur during sleep, was significantly blunted or completely absent. When that dip doesn't happen, your heart works through the night at near daytime pressure levels. 7 hours. Every night. That's not occasional stress, that's a structural load. Now add one final layer. Frank slept curled up. After a full dinner and wine, the body naturally wants to curl inward. Knees up, shoulders rounding forward, chin tucked. It feels like safety. But in that position, your rib cage compresses. Your lungs can't expand fully. Every breath for the next 7 hours is shallower than your respiratory system was designed to produce. Research in respiratory physiology and neurobiology confirmed that significant spinal flexion during sleep measurably reduces tidal volume, the amount of air per breath. Frank wasn't dealing with work stress. He was dealing with 3 simultaneous problems: reduced circulation, erratic blood pressure, and restricted oxygen, all while unconscious. I gave him 3 rules: finish dinner at least 3 hours before bed, stop alcohol at least 4 hours before sleep, and put a firm pillow behind your lower back to prevent curling tight. 6 weeks later, Frank had not woken up at 2 a.m. once. At his follow-up, he said, "I didn't change my medication. I changed my dinner schedule." I'm not telling you to never eat a late dinner. I'm not telling you to give up a glass of wine. Life is not a clinical trial. But if you're regularly waking up between 1 and 4 a.m. with your heart racing, and you've been told it's just anxiety, look at the 2-hour window before you fall asleep. The answer might be on your dinner table. What time do you usually eat dinner? And what time do you go to bed? Drop your gap in the comments. I'm genuinely curious how many people are in that window. Everything so far has been about what to stop doing. Now let's talk about what actually works. But before I show you, I want to be honest about something, because I've watched it happen too many times to stay quiet about it. Sandra's off-rhythm nights weren't going to disappear on their own. Frank's 2 a.m. wake-ups were getting more frequent, not less. The body compensates until one night it simply can't anymore. I'm not saying this to scare you. I'm saying it because what I'm about to share is genuinely simple, and the only reason most people haven't done it is because nobody told them it existed. What I'm going to give you is what the evidence actually supports and what I've seen make a genuine difference for real patients over 28 years of clinical practice. 2 positions. One is better for most people, the other is better for specific situations. Here's how to figure out which one is right for you. Position 1. Left side sleeping. If you've been a right side or back sleeper for 20 or 30 years, your body is not going to love this immediately. Expect 1 to 2 weeks of adjustment. That's completely normal. Don't give up after night 3. Get a full-length body pillow, a real one you can hug in front of you. This prevents your top shoulder from collapsing forward and keeps you from rolling back onto your right side during the night. Put a small pillow between your knees. This maintains your lumbar curve and takes pressure off your hips. You will roll over during the night. You will not stay on your left side for 8 straight hours. That's fine. The goal is to start there during your early deep sleep window. Position 2. Back sleeping with full upper body elevation. This one is for people who genuinely cannot sleep on their side. Shoulder arthritis, rotator cuff injuries, hip problems, severe acid reflux. The detail most people miss. It's not about elevating just your head, it's about elevating your entire upper body at a gradual incline, roughly 15 to 30 degrees. Elevating only your head bends your neck forward. That creates the exact same vertebral artery compression problem we saw with Raymond. You've solved one issue and created another. A wedge pillow is the most practical tool here, available at any medical supply store, usually under $50. Add a small pillow under your knees when you use this position. 3 things improve with correct elevation. Venous return from your lower body gets better. Intracranial pressure decreases, and your airway stays more open through the night. Important: if you have diagnosed obstructive sleep apnea, talk to your sleep specialist before switching to back sleeping. Left side is almost always the preferred position in those cases. Left side for most people. Elevated back for those with joint issues or circulation concerns. And for everyone, 1 properly supportive pillow under your head, not 3. Your body doesn't need to be forced into the right position, it needs to be supported into it. There's one more layer I want to cover. It's not a position, it's a room. And one change to your environment can either undo everything we've covered or make it work twice as well. 5 years ago, I made one change in my own bedroom. Not the mattress, not new pillows, not a fancy sleep tracker. I dropped the thermostat 4 degrees. I'd been keeping my room at 72. I switched it to 67. And within 10 days, I was waking up more alert than I'd felt in years. Here's why it worked. Your core body temperature needs to drop roughly 2 to 3 degrees Fahrenheit to trigger deep sleep. A warm room fights that process every step of the way. Sleep research consistently points to the same range, 64 to 68 degrees Fahrenheit. Not cold enough to be uncomfortable, just cool enough to stop working against your biology. Cooler environments also correlate with lower nighttime heart rate and better nocturnal blood pressure regulation, including that natural pressure dip we talked about with Frank. The second factor, light. After 9 p.m., blue light from screens suppresses melatonin production. Melatonin isn't just a sleepiness signal, it's your body's cue to downshift for the night. Think of it like an airplane trying to land on a runway with inconsistent lights. The approach works technically, but it's not clean and it costs more fuel. Your brain needs a steady signal to descend into deep sleep. Phone down by 9 p.m. when you can. Warm, dim lighting in the hour before bed. These aren't minor tweaks. They're signals your nervous system is actively reading. Third, sound. You don't have to be fully awakened by noise for it to damage sleep quality. Irregular sounds pull your brain out of deep sleep without you ever becoming fully conscious. Heart rate spikes briefly. Cortisol ticks up. You drop back into sleep, but into a shallower stage than before. Those micro disruptions accumulate over 8 hours. A white noise machine or a basic fan creates a consistent sound backdrop that masks irregular noise. Simple, inexpensive, genuinely effective. Temperature, light, and sound. 3 environmental variables, all of them adjustable tonight without spending $1. Is your bedroom set up for recovery or just for sleep? There's a real difference between those 2 things. Tell me one thing in the comments you could change in your room tonight. Now I want to bring everything together and tell you about that marathon runner I mentioned at the very beginning. Michael was 58. He ran marathons not competitively, just for the feeling of it. 4 mornings a week, before sunrise, 6 miles through Lincoln Park. His wife told me he was in the best shape of his life. He had a stroke on a Tuesday morning in March, a transient ischemic attack, no permanent damage, but frightening enough that his wife drove him to my hospital at 5 a.m. and sat in the waiting room for 4 hours. When I went through his history, everything looked solid. Blood pressure excellent, cholesterol managed, no smoking, no family history, 7 consistent hours of sleep every night. But he ate dinner at 8:30 after his evening run, a glass of wine to wind down, slept flat on his back, 3 pillows, had done it for 20 years. The night before his thanks in advance, his wife told me he slept perfectly. He didn't move once, just slept straight through. 7 hours of perfect stillness. In almost every position we've talked about today, that case changed how I think about sleep, not as something passive that happens to us, but as something our bodies are actively doing and something we can either support or undermine, one night at a time. Michael made the changes. He adjusted his evening schedule, started sleeping on his left side, raised the head of his bed. He still runs 6 miles, 4 mornings a week. But he said something at his last follow-up that I haven't stopped thinking about. I thought sleeping well meant not waking up. Turns out that was the lowest possible bar. Here's what I want you to remember. Flat on your back with no support, elevate slightly. Stacked pillows, bending your neck swap to one contoured pillow. Right side with heart or blood pressure, history move left. Dinner and alcohol within 2 hours of bed, give yourself the gap. Cool, dark, quiet room. Not optional, not a luxury, necessary. You don't have to change everything tonight. Pick one thing. Start there. Give it 7 days and pay attention to how you feel in the mornings. If you have existing cardiovascular conditions, blood pressure issues, or diagnosed sleep apnea, please bring these adjustments to your doctor first. This is a starting point, not a prescription. One last thing, and I mean this. The most expensive thing you own isn't your car or your house. It's the 8 hours a night you spend unconscious. Most of us have never once thought about whether we're spending them well. If something in today's video changed how you think about sleep, drop it in the comments. And if you know someone who wakes up exhausted every morning and can't figure out why, send them this. I'm Dr. Malik Jackson. Sleep well tonight. Your brain and your heart are both counting on you to.